And I'm the program director at DUF. And next it's my pleasure to introduce Helen Vasquez, who's a skin cancer survivor, and she's going to share her story with us.
I didn't know it would be such a large group. I will just begin by saying that when I grew up, we had no knowledge, no sunscreen, no knowledge. And what we did was we put on baby oil. And the darker we could get, the better. It was the era of the healthy tan. But I am so pleased that over the last many years, it has become a common topic of conversation. That's what made it important. So 17 years ago, I had my first case, and it was on my arm, and I did everything wrong the doctor spoke about, and I thought it was a wart. And so I kind of picked that. And did okay. So then it got kind of bigger, uglier, and more gross. And fortunately, it was visible because who knows what I would have done if it weren't. But I did go, and I had it surgically removed. And that was the very beginning of my gratitude, because he evidently had to dig quite deep, and I had 7 stitches internally and 7 stitches externally. And his description of the roots and how far they had gone was not pleasant. So from then on, I began being proactive. Yes, sunscreen. Also, I read everything I can. If the word skin cancer appears for a newscast, as a headline or whatever, paper, magazine, whatever, brochure, I grab it, I read it. Anything that says skin cancer, I do my little program of research. The next one, cancer that I had, was on my leg, and my dermatologist just referred me directly to radiation oncology, and fortunately it was Dr. Collin. And I discussed with him, when I had one surgically removed, why not, it didn't appear to be a choice for the leg. And as he mentioned, there are different reasons. The extremity, it being the leg, it being thinner skin, the healing process was much more difficult. And the chances were also greater of the surgery not getting it and having to have it done once and then skin grafts and whatnot. So all I wanted was education, and I got what I wanted. I did have the Robbie robot brachytherapy. He was partnered in the room with me. It does take just a moment, and it's a little cone that they put on the spot, and then, as he said, the tube, the radiation, very quick, and it healed beautifully. As the skin is coming to the surface and it dies off, it's a oozy, ugly sore, but it is no big deal, and you have it covered. Afterwards, the scar that is there, my leg was about a year plus ago, it just continually fades. And as far as I'm concerned with my gratitude, I don't care about the mark. To me, it's a badge of honor that it was minimal, it was caught, no complications. I had, maybe it was on my face, I might be a little more vague, but I was just so grateful for the developments that we have and the proactiveness and the education. Then, and what I want to say is, okay, so this was ugly, and the one on my leg was entirely different. It was like a bulge and almost under the skin, and it itched. So after a few, weeks of attacking it with the itching, it became sensitive. And I mean, if I would put cream on my leg, it would be sensitive in a negative way. When my pant leg rubbed against it, it was sensitive. So right away I knew. And so I went in, that's what happened. I had brachytherapy, healed beautifully. But my third time, which is obviously because of all my sun worshiping, my third time was just 6 months after my leg, and it was entirely different. The teeniest little bump. And again, like they said, thought maybe it was a pimple, but it didn't come and go. There was nothing there to squeeze, attack. And so immediately I went in to my dermatologist, and she said, okay, biopsy, right here. So it was the left leg, it must have been left leg, left shoulder, and left arm. But she basically had no choice because I wanted that thing out. So she did biopsy it, and then she said I could either, have it surgically or the radiation. Well, of course, I ran back to Dr. Comet, and he explains that the difference was the location. This would heal from surgery, it would heal from the radiation, and I really had a choice. Where the leg being where it was and the thin skin and all that, it was best for the radiation. So again, I did choose the radiation, had it done, and again, beautifully. Just minimal, but my gratitude far overwhelms any mark on my skin. Now, I am extremely diligent. I examine everywhere. I clean my whole body, and I pay attention when I do it so that if I feel anything, and I mean feel with my fingers, but also like on my leg, it was an internal feeling. I see my dermatologist once a year by the calendar, but more so than that, if there's a blip on my skin, I run it. I just run it. Oh, yeah. I'm sorry, thank you for asking. This one was squamous, and my leg and my shoulder were both basic cell. Yeah, sorry. And so now, besides my dermatologist being my best buddy, I use sunscreen. My makeup all has SPF in it, and I think 3 different things that I put on had the SPF. And as I said, I read anything and everything that I can get my hands on. And every poor doctor that I visit, I just ask and ask and ask and ask. Not only verbally, but any information. And that's part of the proactiveness. And again, I just, because of my wrist especially, but then 3 times, I just feel so fortunate that I'm just very grateful. And now the research and the word is out, so just take advantage of it.